EAPC's roots run extremely deep in healthcare. In 1967, when the firm was founded, our very first client was United Healthcare in Grand Forks. In 1992, Ray Ingen, president of EAPC, made the strategic decision to hire Alan Dostert, a healthcare architect who was working with another firm at the time, who was doing all of United Healthcare's work. Shortly after starting the Fargo office in 2000, we established a relationship with a firm out of Denver that did nothing but wellness centers, but they didn't have any healthcare experience. So they called us, and that started an $80 million project for a heart hospital in Cape Girardeau, Missouri. What the heart hospital project taught us was that we can work all over the country and we can work on very large healthcare projects.
What makes me want to be a part of this culture is that even with that immense collective expertise, there's just this unspoken willingness to check the ego at the door, fully buy into what we're trying to accomplish, and consistently prioritize our clients' projects, and the way in which we serve them.
The next strategic decision that we had to make was where were we going to start our new office? The obvious choice was Minneapolis-St. Paul.
The team that we've assembled here has incredible experience. We've got senior staff that's worked for some of the largest healthcare design firms in the world on complex projects all across the country, well into the 8 and 9 figures of construction value. While we are not always as flashy as some of those we compete with, we are certainly capable of doing all of the things that they do.
In 2015 and 16, we found that we were working for 3 of the largest healthcare organizations in the Minneapolis-St. Paul area.
One of the things that I'm the most proud of is not only are we working with many of the most well-regarded systems in each of our major markets, but each and every one of them is a repeat client, many of them several times over. I don't think there's a better reference for our credibility and our capabilities than having repeat clients across the country. At EAPC, we understand that our clients' goals are not always going to be the same, whether it's project to project or client to client. Therefore, as consultants, we can't approach every design engagement in the same way. When the goal can be as pragmatic as minimizing the downtime between patients on an equipment replacement, we need to focus on and buckle down on things like selecting readily available materials, coordinating closely with the construction manager, and not overcomplicating the design intention.
My first conversations on project definitely are oriented towards their goals, really diving in and understanding that and establishing how we can get there, whether it be time, schedule, budget, or ultimately the vision that they see operationally. They want this project enforced and kind of realized in a built environment.
Our role is to develop a level of trust, get to a point where we can be a trusted advisor, and then from there, facilitate an inclusive process where we can collectively develop a solution that is the best for all stakeholders.
We owe them our hard work and attention. That's one thing that we definitely pride ourselves on as a company, is we will work hard to create creative solutions for them and really challenge the status quo operationally that they have. We want to bring that innovation to them and really pride ourselves on that.
We might have stakeholders from pharmacy, we might have stakeholders from nursing, all of whom use the facility in a very specific but very different way. Being able to hear them talk through how they would like to use the facility rather than how it's designed allows us to then come back and apply those best practices, apply those precedents to the design outcome that we're putting forward.
We understand that these opportunities aren't just given, they're earned. So in our mind, we take this very seriously and really partner with our experienced staff to create that overall goal in creating those environments, no matter the complexity of the projects for our clients.
We are extremely grateful for our long-standing client and health system relationships. This is a group of people who everybody at EAPC feels strongly about, who we protect and advocate for, and who we take an immense amount of pride in being associated with.
The patients continue to come back to a particular area or hospital because of the care they're getting, the facilities they're getting. It's not white, it's not clinical, it's not scary.
Being able to zoom out and truly understand the breadth of people who may be impacted by any one of these spaces allows us a deep and holistic understanding of where our priorities should be.
Hospitals can be scary. They're clinical, they're oftentimes frightening. People are very sick, and we're trying to bring in elements that will be calming for them, make it more feel like at home.
Patients are rightfully at the front of this discussion, but designing spaces to put their families or caregivers at ease, as well as a space that allows the providers themselves to be in the best position to provide care, is all a part of building that trust and rapport that we truly understand what it means to be your design partner.
We start very closely working with the client one-on-one. Okay, what's the project? What's the scope? What are we trying to accomplish?
We've never had access to more information than we have today. Everything from data and demographics for master planning purposes to minutia around how many steps it takes for the provider to get to the patient today and in the new plan. We need to leverage the access to the information we have to continue to innovate into what's next in healthcare spaces.
This approach has a lot of benefits. We consider the whole built environment as a harmonious design, considering the patients, the staff, and those who work there. It's gone a long way to improve the rapid healing process.
As we have grown in scale and amassed talent, these personal and professional relationships have only become stronger.
We look forward to working with our long-standing clients, not only now, but far into the future, and really have appreciated their support over the last number of years. It's been very beneficial, and we're very thankful for that.